For centuries, humans have been obsessed with vision, not just having it, but understanding it, fixing it, and ultimately revolutionizing it. Welcome to the Visionaries, where we celebrate the pioneers who helped us see the world more clearly, one innovation at a time. The Egyptians thought eye diseases were punishments from the gods. Their solution: eye makeup containing antimicrobial properties. Talk about killing two birds with one stone, look fabulous, and fight infection. By medieval times, we'd upgraded to primitive spectacles. No designer frames yet, unless you count medieval monk chic as a fashion statement. But the real revolution was still to come, and like many medical breakthroughs, it would require someone to say, "I wonder what would happen if I put this inside someone's eye." Enter Sir Harold Ridley, who in 1949 had a thought while observing RAF pilots with eye injuries. If airplane canopy material doesn't irritate the eye when it gets in there by accident, perhaps we could put it there on purpose. And thus the intraocular lens was born. But who would perfect this technology? Who would take Ridley's vision and carry it forward? Retina, the very company that manufactured Ridley's first intraocular lens. Talk about being in the right place at the right time. Retina didn't just witness ophthalmic history, they wrote it. In 1949, they created the world's first intraocular lens, and they haven't looked back since, though their patients certainly have with much clearer vision. While others were still asking, should we put plastic in people's eyes, Retina was already asking, how can we make this plastic better? Their pioneering spirit led to the development of the world's first truly modern foldable intraocular lens in 2007. Remember when cataract surgery meant a week in the hospital and sandbags to keep your head still? Retina said, let's make this a lunchtime procedure instead. Revolutionary thinking that patients and healthcare systems alike have thanked them for. But vision correction isn't just about replacing cloudy lenses. It's about precision, calculations, and increasingly, artificial intelligence. Enter Sophie, the smart ophthalmic platform for healthcare innovation. When most companies were still using calculators and crossing their fingers, Sophie brought artificial intelligence to lens power calculations. Wow. Sophie's competitive edge? Their algorithms can analyze thousands of previous surgeries to predict outcomes with uncanny accuracy. It's like having the collective experience of hundreds of surgeons right at your fingertips. Measure twice, cut once has evolved to let AI measure, then cut perfectly. The difference between a good and great surgical outcome is often measured in fractions of a millimeter. Sophie's platforms reduce those variables, turning good surgeons into great ones and great surgeons into legendary ones. But even the best calculations need exceptional instruments to execute the plan. That's where Repair steps in, the Swiss watchmakers of ophthalmic instruments. When Repair introduced their micro-incision toolset in the early 2000s, it was like going from performing surgery with gardening tools to using precision lasers. Their instruments reduced incision size from over 3 millimeters to under 2 millimeters. A millimeter might not sound impressive until you realize it's the difference between weeks of recovery and going back to work the next day, not to mention the reduced risk of astigmatism, because nobody wants to trade cataracts for astigmatism. That's like swapping your flip phone for a fax machine. While competitors were still using stainless steel, Repair pioneered titanium instruments, lighter, stronger, and more precise. Surgeons' hands rejoiced worldwide, especially around hour 8 of a surgical day. Together, these innovators haven't just participated in the evolution of ophthalmology, they've driven it. 1950s, multi-day hospital stay, thick glasses afterward, and a recovery measured in months. 2025, 20-minute outpatient procedure, multifocal lenses, and you're reading fine print by dinner. 1949. Retina produces the first IOL, 1967, first phacoemulsification by Charles Kellman. 1998, Sophie pioneers the first AI-assisted biometry. 2003, Repair introduces sub-2 millimeter surgical instruments. 2010, Retina launches the fully preloaded IOL injection system. 2020, Sophie introduces cloud-based surgical planning accessible worldwide. And in 2023, Repair's diamond-coated instruments extend tool life by 300%. The result? A symphonic collaboration where Reina's lenses, calculated precisely by Sophie's algorithms, are implanted with Repair's instruments. creating outcomes that would make Sir Harold Ridley shed a tear, which, thanks to these innovations, he'd be able to see clearly. When we celebrate ophthalmology, we're not just celebrating medical advancement, we're celebrating the human experience of sight itself, the ability to see a loved one smile, read a favorite book, or witness a sunset in all its glory. From the first crude glasses to today's sophisticated lens implants and laser procedures, we've come an extraordinary distance. And with companies like Retina, Sophie, and Repair continuing to push boundaries, the future looks, well, crystal clear. Now, so here's to the visionaries, both those who create the technology and those who implant it. Because of them, millions of people around the world can wake up each morning and do something truly remarkable. Open their eyes and see.